Assalamualaikum warahmatullahi wabarakatuh. Hello everyone, we from Group 5 will present hypertension. Before that, let me prepare members of Group 5. I'm Alia, then there are Lia, Zea, Eve, Nabila, Becca, and Vira. Next, I will give a little brief explanation about hypertension. Hypertension, commonly referred to as high blood pressure, is a chronic medical condition characterized by consistently elevated levels of blood pressure in the arteries.
So hi everyone, my name is Rebecca Polnebaho and my NM 2410911120007. So today I'm gonna explain to all of you why which is hypertension as our topic in this presentation. As you can see in our slide, we have chosen this topic for our presentation because it is a significant global health issue that affects millions of people. Hypertension, commonly referred to as high blood pressure, is often called the silent killer because it usually has not visible symptoms but can lead to severe complications such as heart disease and kidney failure.
Okay, next, let me introduce myself first. My name is Elza Vinalia and I'm going to show you this slide. Okay, presentation objective. So first, we have providing education about the hypertension. So we need to know explain what hypertension is, its cause, symptoms, and health impact. And two, raise awareness about the importance of regulating and managing high blood pressure. Two, we have increasing awareness, like highlight the risk of complications such as heart disease, stroke, and kidney failure caused by hypertension. Next is like definition about hypertension. So hypertension, also known as high or raised blood pressure, is a condition in which the blood vessels have persistently raised pressure. Blood is carried from the heart to all parts of the body and the vessels. Each time the heart beats, it pumps blood in the vessels, and blood pressure is created by the force of blood pushing against the wall of blood vessel, artery, as is pumped by the heart. And the higher the pressures, the harder the heart has to pump.
So next, I will be explain about the causes and effects of hypertension. Hypertension can be classified into two main categories. The first one is the primary hypertension and the second one is the secondary hypertension. The first one, the primary hypertension, is the most common type of hypertension. It develops gradually over time and does not have a specific identifiable cause. However, several factors influence its onset.
So next is data and facts. According to records from the World Health Organization or WHO, in 2011, 1 billion people in the world suffer from hypertension, 2/3 of whom are in developing countries with low and medium income. It is predicted that by 2025, around 29% of adults worldwide will suffer from hypertension. Hypertension causes the death of around 8 million people every year. What is hypertension? Hypertension or high blood pressure is a condition when blood pressure is 130/80 mmHg or more. This condition can cause various health complications that are life-threatening if left untreated. Although, in general, hypertension sufferers don't show specific symptoms or complaints. There are non-specific complaints that hypertension sufferers can experience, including 1. Headache and dizziness, 2. Pain in the chest, 3. Blurred vision, 4. Get tired easily.
Assalamualaikum warahmatullahi wabarakatuh. Let me introduce myself. My name is Afra Sutrinedi with student ID 2410911320032. Today, I will explain about comparison of hypertension cases in Indonesia over the last 5 years and future predictions regarding hypertension in Indonesia. Over the past 5 years, the prevalence of hypertension in Indonesia. After that, I will explain about future prediction regarding hypertension in Indonesia. Predictions regarding hypertension in Indonesia show an increase in awareness and control efforts, although its prevalence remains a significant challenge. According to recent data, hypertension is still a leading risk factor of death and disability in Indonesia, with a relatively high prevalence among adults. especially in older age groups.
So, how to prevent hypertension? These are the healthy lifestyle methods and tips that you need to apply to prevent high blood pressure. Number one is reduce salt. One of the causes of hypertension is excessive salt or sodium intake in your body. The more salt you consume, the higher your risk of experiencing an increase in blood pressure. Apart from table salt, foods that contain high sodium include canned food, packaged food, processed food, frozen or preserved food, snacks, and fast food. And for this reason, you should avoid this food to prevent hypertension. And if it is really necessary, you should check the label of the packaged food you buy and choose food with low sodium levels. Number two is exercise regularly. Exercise is a need for everyone because it can maintain overall body health and including preventing hypertension. Especially for people with hypertension, exercise can reduce the need to take high blood pressure medication. And in fact, people who exercise regularly have a lower risk of hypertension than those who don't exercise at all. The reason is regular physical activity or exercise can strengthen your heart, so it can hit your blood more easily. Number three is maintain ideal body weight. People who are overweight or obese are at greater risk of developing hypertension, up to 2 to 6 times more than people who are not obese. And therefore, maintaining an ideal body weight is one of the important efforts to prevent hypertension. And this happens because obese sufferers have excess fat tissue in their bodies, so that blood vessel resistance increases, and this condition can cause the heart to work harder and blood pressure to increase. So try to maintain an ideal body weight by changing yourself to be healthier. Number four is avoid alcohol. Drinking alcohol too much and frequently can increase blood pressure drastically. If you drink several glasses at a time, your blood pressure rises temporarily. However, drinking too often can trigger hypertension in the long term. Therefore, it is a good idea for you to avoid drinking alcohol as a form of prevention of hypertension. Number five is consume healthy and nutritious food. Preventing hypertension also needs to be balanced by consuming foods that are healthy and contain the nutrients the body needs. And for your information, the mineral that plays a very important role in maintaining blood pressure is potassium. Potassium can balance salt or sodium levels in your body, thereby preventing hypertension. And you can find potassium in various high blood pressure lowering foods, especially fruits and vegetables. And apart from potassium, other nutrients needed to maintain blood pressure are calcium, magnesium, and fiber. And besides fruits and vegetables, you can fulfill your needs by consuming whole grains or nuts. Number six is limit caffeine. Apart from alcohol, you also need to limit your caffeine intake to prevent hypertension. The caffeine content can be found in various drinks such as coffee, tea, soft drinks, and energy drinks. And caffeine is known to increase blood pressure in some people, especially those who frequently consume caffeinated coffee. And therefore, you should not consume more caffeinated drinks than limit to prevent high blood pressure. Drink tea and coffee in moderation and don't make these drinks your main source of fluid. Number seven is stop smoking. Smoking is not only bad for lung health but can also increase your risk of developing hypertension and heart disease. Nicotine and other harmful ingredients in cigarettes can increase blood pressure and heart rate by narrowing and hardening your arteries. Therefore, you need to avoid smoking as a form of prevention against hypertension. Number 8 is manage stress. You know, when stressed, your body produces certain hormones that can speed up your heart rate and narrow your blood vessel, causing your blood pressure to rise. However, when the stress disappears, your blood pressure will return to normal. And stress can also cause long-term hypertension if it continues and cannot be controlled. Therefore, you need to manage stress well as a way to prevent hypertension. And to manage stress, you need to know the causes of stress that often occur to you. Avoid and overcome these causes of stress so that it doesn't happen again next time. And do healthy things that can relax you to prevent high blood pressure, such as listening to music, meditation, yoga, or doing your hobby. That would be very helpful. And don't forget to take care of your sleep to avoid stress. And finally, another important thing you need to do to prevent high blood pressure is to check your blood pressure regularly and periodically. This way, you can find out whether your blood pressure is normal or not. And the reason is high blood pressure or hypertension doesn't have specific symptoms, and checking blood pressure is the only way to find out whether you have hypertension or not. In the end, why is it so important for us to prevent hypertension? Because hypertension itself, apart from being the main causes of premature death, so also many complications which have a very high mortality rate, such as coronary heart disease, heart attack, stroke, and even death. And in order to achieve success in preventing hypertension and successfully controlling the condition of hypertension, patients should cooperation with the doctor, or patient discipline is needed in managing a healthy lifestyle according to what has been conveyed. And it is better to prevent before treating. That's all from me. Thank you.